We're a social business with a cervical cancer screening technology, and we're focused right now on deploying our technology in East Africa to help decrease unnecessary deaths from cervical cancer. Cervical cancer screening is really critical when it comes to decreasing mortality from this cancer because it's very easy to diagnose and treat when we catch it early. But oftentimes a woman who has precancerous cells on her cervix doesn't feel any pain or discomfort, which is why we need to screen her. In Kenya, the standard of care is a clinical procedure called visual inspection with acetic acid, followed by visual inspection with Lugol's iodine. And we abbreviate that as VIA-VILI. Currently, the way that that's done in Kenya is to use the naked eye, meaning that a health professional inserts a speculum into a patient, she swabs her cervix with the reagent, and then looks to try to see areas that might be precancerous or cancerous. So I log in with my unique credentials into a secure system. I tap Add a New Patient. I enter some basic patient information. And now I can use the technology to visualize the cervix in real time. And if I'm a health professional, it helps me make an informed diagnosis on what I'm seeing. So I look through the viewfinder. If we pretend that my hand is a cervix, you can see just like this. And if I swipe up, I zoom in, and as you can hopefully see on the screen, you can actually see my fingerprints. So that's the level of magnification and image clarity that we're seeing. And I can capture images as well. So following the examination of a patient, one thing that we've seen here in Kenya that women really like is to be shown their cervix. So after a visual inspection examination that's done by a health professional, the patient will sit up and the nurse will show her what she was seeing when she performed the examination and is able to explain to the patient what took place during the examination and why or why not her cervix is healthy. We have seen such excitement here in Kenya from women who are seeing their cervix for the first time because these women are coming to us and saying that they're hearing a lot about cervical cancer and how it's important to be screened. But for a patient, it's not always clear what's going on. What's actually happening during a cervical cancer examination? So now with the technology, a nurse is able to explain that and show the patient what the nurse was seeing. We can also use the connectivity features of the app for ongoing telemedicine or expert consultation in case there's some lack of clarity or for example, the nurse has some questions about what she's seeing. She can consult an expert and in real time get expert advice and opinions on the patient that she's seeing. The last thing that we can do with the technology is the treatment decisions are recorded. And so what that means is that we are able to see what's happening in Kenya in real time in terms of the prevalence of cervical cancer and how many women are being screened and how many women are being treated. This is anonymized data. There's nothing that's patient identifiable within it, but it allows people at the national or regional level to have a better understanding of what's going on within communities all over Kenya. So there are a few ways to screen for cervical cancer. One of them is visual inspection with acetic acid. Another one that we sometimes see here in Kenya is a pap smear. The two tests are done quite differently. In pap smear, a specimen or a sample is actually collected from the patient. It's put onto a slide, and then that slide is transported to a trained lab technician or cytologist who will look at the slide under a microscope and use it to diagnose whether there's any evidence of precancer or cancer. The pap smear is a great test, but it has some challenges as well. The first of which is cost. It's an expensive test to do, and it's also logistically complicated. So when a specimen is collected from a patient, sometimes it can be difficult because that specimen needs to be transported to a centralized location and then evaluated, and then those results need to go back to the patient. And following that, then we need to actually decide whether any treatment is necessary. So what we're seeing a lot now be recommended in settings such as Kenya is something called the single visit approach, which uses visual examination with acetic acid. There are a few advantages of using visualization with this, visual inspection with acetic acid. The first of which is that the results are done in real time. So a patient who comes in for screening doesn't need to wait at all. She gets the results immediately if she's healthy or potentially unhealthy. The other thing that's important about visualization, visual inspection with acetic acid, is that it's more cost effective. Pap smear, again, it's a great test, but it can be cost prohibitive in some settings. The other important thing to note about Pap smear and visual inspection with acetic acid is that when it comes to the sensitivity of these tests, they are roughly comparable. They're not exactly the same, but each of those tests is roughly equivalent at being able to detect the presence of precancerous or cancerous tissue within the cervix.